Right now, I mean, literally right at this exact moment, someone on their lunch break is probably popping out of their office, walking into a clinic, and spending like $1,200 to inject dermal filler into their most intimate anatomy.
Yep, just right between answering emails.
Exactly. There's no major surgery, no hospital gown. It's just a quick 15-minute appointment to upgrade their sex life before they head back to work. So, welcome to this custom deep dive designed specifically for you. I'm your host, and I am so ready to get into this.
And I'm the expert for today. Really excited to guide you through this wild stack of research you sent over. It's quite the landscape we're looking at.
It really is. I mean, looking at the sources you provided, it's just wild to see how broad the modern medical and cosmetic landscape has become. Like, on one hand, we've got these super strict UK government regulations on GLP-1 weight loss drugs, like Wegovy.
Right. Very heavy systemic clinical stuff.
Yeah. Yeah. And then we have these incredibly intricate fertility treatments, like ICSI, which is intracytoplasmic sperm injection, where doctors literally inject a single sperm directly into an egg.
Which is just a massive medical marvel on its own.
Totally. But then, sitting right next to that deeply clinical data, we have articles about drive-through cosmetic enhancements and, urology procedures for men. But even though this landscape is so vast, today we have one laser-focused mission for you.
Just one core question to answer today.
Right. We are going to definitively answer whether a specific procedure, the G-shot, is covered by medical insurance. And we're going to break down exactly what this is going to cost you. So let's jump straight into the deep end here. Is this procedure covered by health insurance at all?
The short, definitive answer to that is, well, no, not at all.
Wow, just a hard no.
A hard no. The G-shot is strictly an out-of-pocket expense. If we look at the clinical data from Dr. Jennifer Berman's practice in Beverly Hills, which, by the way, is a very prominent clinic operating in this space, they state unequivocally that health insurance just does not cover the G-shot.
Not even partially.
Not even partially. Across the board, globally, insurers universally classify this procedure as an elective cosmetic procedure. So, in the eyes of the insurance provider, it simply does not meet the threshold of being a medical necessity.
Okay, let's unpack this, because this is where I find myself getting a little confused on behalf of the patients who actually have to navigate this system.
It is a very frustrating system to navigate.
Right, because I'm looking at the GLOWM textbook in our sources, the Global Library of Women's Medicine, which is a massive, very serious clinical resource, and it notes that female sexual dysfunction, or FSD, is incredibly common.
Yes, the numbers are actually staggering when you really look at them.
They are. The data shows it affects anywhere between 29.7% to 43% of women globally. That is a documented, widely recognized medical issue that causes, real measurable distress in patients' lives.
Absolutely. It's not a trivial thing.
So if sexual dysfunction is a validated medical issue, why is a clinical treatment that could potentially alleviate it treated the exact same way as, getting a cosmetic lip filler? That feels like calling physical therapy a spa day.
Yeah, I totally get that comparison. And if we connect this to the bigger picture, it really comes down to how medical establishments and insurance companies rigidly define a disease versus an enhancement.
Okay, how do they draw that line?
Well, insurance companies draw this really unapologetic line between treating a structural anomaly or a life-threatening illness and enhancing physical pleasure. They just don't see pleasure as a medically necessary right.
Oh, it's kind of bleak.
It is. And to see how aggressively they enforce this boundary, we only need to look at another procedure covered in your research, labiaplasty.
Right, we had a whole University of Geneva study on that.
Exactly. That research highlights just how difficult it is to get insurance coverage, even for labiaplasty, which very often has actual physical discomfort associated with it, like chafing or pain. But in Switzerland, insurers rarely cover it unless a specific doctor known as a médecin conseil provides strict medical justifications.
And those justifications aren't just like a doctor's note saying the patient is uncomfortable. Right?
Oh, no, not at all. They actually require exact physical measurements and documented proof of physical injury or severe mechanical symptoms to even consider reimbursing the cost. They basically demand objective proof of a structural disease.
That sounds exhausting to prove.
It really is. Now, interestingly, that same research points out that France operates as a unique outlier here.
Oh, really? What does France do?
In this specific arena, their Social Security actually refunds labiaplasty 100%.
Wow, that is a huge difference.
Yeah, it's a massive cultural and medical outlier. But the G-shot faces a much higher hurdle than labiaplasty because of its physiological mechanism.
Okay, walk me through that mechanism. What are they actually doing?
So the G-shot involves taking hyaluronic acid and injecting it directly into the anterior vaginal wall. The whole point is to physically expand the Grafenberg spot.
Just to make it larger and more pronounced.
Exactly. The stated clinical goal is strictly heightened pleasure, increased friction, and intensified orgasms. And because it doesn't cure a structural defect or a life-threatening illness, insurers globally just write it off as purely aesthetic. There is no diagnostic billing code that is going to force an insurance company to foot the bill for heightened sexual pleasure.
Which means it is entirely on you, the patient, to open your wallet.
Every single penny.
So that brings us to the next massive question for our listener. What is the actual global price tag for this? Because since it's strictly out of pocket and untouched by insurance regulations, I assume the free market is going to completely dictate the cost.
It does. And the variance in that free market is staggering. Like, it's all over the place.
Give me the numbers.
Well, the global pricing data from Bookamed shows the average cost for a G-shot is hovering around $1,200. But geography dictates absolutely everything about that price tag.
So where you live is what you pay.
Pretty much. In the United States, if a patient is looking at specialized clinics in Chicago or Beverly Hills, they can expect to pay anywhere from $1,000 to $2,500 for just a standard baseline treatment.
That's a huge range. And the UK market has an interesting historical curve to it as well, based on the sources.
Yeah, that Evening Standard piece from back in 2012.
Right. They featured a first-hand account of a journalist getting the procedure. I think back then it was marketed as G Delight, and she paid £850 at a clinic on Harley Street.
Which was a lot of money in 2012.
Definitely. But fast forward to modern London clinics today, like Centre for Surgery or Dr. SW clinics, and they are quoting starting prices between £1,000 and £1,800.
Yeah, inflation and demand have really pushed those numbers up. And not only that, but certain U.S. platforms report maximum costs pushing as high as $4,500.
$4,500.
Yep, depending on the specific provider and the customized treatment plan required for the patient's unique anatomy.
Okay, here's where it gets really interesting. Looking at this massive price gap, from a $4,500 premium in the U.S. down to starting prices of like $875 in Turkey. I have to assume we're not just paying for the physical filler itself.
No, the filler is just a fraction of it.
Right, because a syringe of hyaluronic acid filler, like Juvederm or Restylane, costs what it costs globally. We must be paying a massive premium for the doctor's zip code and their specific level of expertise.
That is the primary driver of the cost disparity, hands down. There are basically three main financial variables at play here.
Okay, what's the first one?
First, exactly as you suspected, is the provider's expertise and their overhead. You are ultimately paying for the specialized hands holding the syringe.
Which makes sense. You want good hands for this.
Exactly. A board-certified plastic surgeon or a highly specialized urogynecologist operating a clinic in Beverly Hills is going to command a much higher fee than a general practitioner in a smaller market.
Right.
The premium reflects their specialized training in female pelvic anatomy, which, by the way, is highly vascular and very sensitive, as well as the exorbitant overhead of running a luxury clinic.
Which makes perfect sense. This is an incredibly intimate area of the body. You aren't going to just browse around looking for the cheapest unregulated coupon available on the internet. You want someone who deeply understands the anatomical structures they are navigating.
You really do. And the second major cost driver is the specific type and volume of the filler used. Top-tier clinics use premium, FDA-approved dermal fillers like Juvederm, Restylane, or Perlane.
So brand names matter here.
They do, and the baseline price you see advertised almost always covers just a single syringe. If the patient's specific anatomy requires more filler to achieve the desired augmentation, well, the cost scales up proportionally.
So that advertised price might just be the starting line.
Exactly. And the third factor, which often catches patients completely off guard, is the consultation fee.
Just to walk in the door.
Pretty much. Many high-end clinics charge a completely separate, non-refundable fee just for the initial anatomical assessment and discussion, and that is not rolled into the final advertised price of the injection itself.
Sneaky. And because of that massive geographic price gap, we're seeing a huge boom in medical tourism, which is heavily featured in the material.
Oh, absolutely. It's a massive industry now.
Yeah, clinics in places like Istanbul are heavily capitalizing on this price disparity.
Yeah.
And they aren't just offering the medical procedure in isolation, right? They are offering highly coordinated full-service travel packages.
Yeah, they make a whole holiday out of it.
A patient can book a G-Shot package in Turkey ranging from 900 to 1,200 euros that literally includes VIP airport transfers, hotel accommodation, and dedicated translators.
It's wild. They've effectively commodified an intimate medical procedure into a packaged vacation experience.
It's like, come for the G-Shot, stay for the sightseeing.
Exactly. It perfectly illustrates how globalized and hyper-competitive the elective medical market has become. Patients are willing to cross oceans for competitive pricing.
But regardless of whether a patient decides to fly to Istanbul or just drive down the street to Beverly Hills, there is one crucial physiological and financial reality that we absolutely need to make clear to you, the listener.
Yes, this is perhaps the most critical takeaway regarding the cost.
The hidden catch. The G-Shot is not a one-and-done surgical intervention. It does not result in a permanent anatomical change to the body.
Not even close. It is highly temporary. And to understand why, we have to look at the mechanism of the procedure itself. Like I mentioned, the filler used is primarily hyaluronic acid.
Which our bodies already have, right?
Exactly. Biologically speaking, hyaluronic acid is a naturally occurring sugar molecule that already exists in your skin and joints. When injected, it acts like a microscopic sponge. It binds to water molecules in the tissue, holding onto them to create localized volume and expansion.
Okay, so it plumps everything up.
Right. But because it is a substance the body already recognizes, the body naturally produces an enzyme called hyaluronidase.
Oh, I see where this is going. Which means the body's own enzymes actively start breaking down and metabolizing that filler the second it gets injected.
Precisely. Over a period of months, the hyaluronidase continuously degrades the hyaluronic acid. As the filler is metabolized and absorbed, the physical enlargement of the G-spot gradually shrinks right back to its original pre-injection baseline.
So what does this all mean? It's like inflating a tire with a very slow leak.
That is a perfect way to describe it.
The moment you pump it up to the desired pressure, your body's enzymes start slowly letting the air out until it is completely flat again. So what does this mean for your wallet? It means you are basically signing up for a subscription model for your sex life.
A very expensive subscription model.
Yeah. You are not buying a permanent fix to a problem. You are essentially renting a temporary enhancement, much like a standing Botox appointment every few months.
And what's fascinating here is how wildly the timeline for that physical degradation varies across the clinical data.
Yeah, I noticed the sources couldn't really agree on a timeline.
Not at all. There is no unified, guaranteed consensus on exactly how long that tire stays inflated. Istanbul Medicist informs patients that the results will last about 3 to 5 months.
Okay, 3 to 5.
But then Nor Women's Health in Georgia quotes a lifespan of 3 to 4 months. Meanwhile, certain clinics in Dallas and London claim the effects can last significantly longer, usually estimating between 6 to 12 months.
That variance fundamentally changes the math for anyone budgeting for this. Because, I mean, if an individual metabolizes the filler rapidly and it only lasts 3 months, they are looking at paying that $1,200 average 4 separate times a year just to maintain the baseline effect.
Yeah, the math gets scary pretty quick.
That is nearly $5,000 annually.
It basically becomes a recurring line item in a personal budget. And, the clinics are fully aware of this recurring revenue stream.
Oh, I'm sure they are.
Down There Urology, which is a specialized clinic operating in Chicago, explicitly lists recurring maintenance injections on their public price list for $625 per visit. They expect you to come back.
It's an undeniably brilliant business model for the clinics, but it requires a serious, ongoing financial commitment from the patient. And it makes me hypothesize, if someone is committing to a subscription fee of thousands of dollars a year, what is the actual return on investment?
That is the big question.
Right. Just injecting a hyaluronic acid sponge into an erogenous zone actually guarantee a better experience.
This raises a hugely important point, and it's one that Morgate Andrology explicitly cautions patients about in their clinical materials.
What do they say?
They emphasize that sexual wellness is a deeply complex intersection of psychology, emotion, and physiology. Simply injecting dermal filler into a physical erogenous zone is not a guaranteed magic fix for deep-seated sexual dissatisfaction.
Because it's not just mechanics.
Exactly. If the root cause of a patient's dysfunction stems from relationship stress, severe depression, hormonal imbalances, or just an emotional disconnect with their partner, A physical filler will not solve that underlying issue.
You can't just inject hyaluronic acid into a bad marriage or high-stress lifestyle and expect instantaneous fireworks. The psychological component is just as heavy as the physical one.
It is the heaviest component for many patients. However, we do have to balance that psychological caution with the reported clinical data from your sources.
Okay, let's look at the data.
Both Dr. S.W. Clinics and Dr. Jennifer Berman reference an American pilot study concerning the G-shot. And in that specific study, a very impressive 87% of the women treated reported enhanced sexual gratification and arousal following the procedure.
Wow, 87%. That's genuinely high.
It really is. So for a significant majority of those studied, physically amplifying the tissue truly did translate to a tangibly better physiological experience.
An 87% satisfaction rate is incredibly high for any elective procedure. But, to truly fulfill our mandate to you, the listener, we need to broaden the lens here.
We need to look at the whole picture.
Right, we need to step back and look at the entirety of the medical landscape you asked us to explore. The G-shot doesn't exist in a vacuum. It is just one highly specific menu item in a massive, booming, and frankly unprecedented industry of lunch hour transformations.
We have fully entered a new era of outpatient medicine. I mean, the Guardian article included in the research captures the atmosphere of this era perfectly.
I love that article.
It was so descriptive. We are no longer solely talking about major aesthetic surgeries that require general anesthesia and weeks of painful recovery. The journalist paints this vivid picture of a world where people are literally leaving their offices during their lunch break to visit clinics near Harrods in London.
Yeah, just popping over.
Right. They sit in an esthetician's chair for a few minutes and walk out physically altered before heading back to work.
The sensory details in that Guardian piece are just incredible. The writer describes the clinic smelling like a wet fur coat, woody and dead, which is such a visceral, unglamorous image for a place selling high-end glamour.
It really sets the scene.
And she sits there as an audience of one, just watching a woman get a 15-minute Restylane nose job for 350 pounds. The doctor simply injects the dermal filler directly into the bridge of the nose to smooth out dents and create a straighter profile, and she's done.
Just like that.
Or they discuss macrolane breast injections, a specialized gel filler injected deep into the breast tissue to instantly increase it by a full cup size for 2,000 pounds. It is achieved in mere minutes.
And this rapid-fire modification culture is absolutely not limited to female patients either.
Oh, not at all.
The demand for male outpatient enhancements is surging at an identical pace. Moorgate Andrology, which is one of the primary urology clinics detailed in the data, offers a 10-minute penis enlargement procedure. 10 minutes. The mechanism is almost identical to the facial fillers. They take dermal fillers and inject them directly into the penile shaft to instantly increase the physical girth.
And to be clear on the mechanics of that, because I know people are wondering.
Yeah.
They aren't just jabbing sharp needles into the tissue, right? They use a cannula.
Yes, thankfully. They use a cannula, which is essentially a flexible, blunt-tipped tube.
Okay, phew. That sounds slightly less terrifying.
Right. Instead of a sharp needle that slices through tissue and risks piercing blood vessels, which would cause severe bruising and damage, the blunt cannula gently pushes the internal tissue aside as it delivers the filler.
It just kind of glides in.
Exactly. It allows the practitioner to distribute the hyaluronic acid smoothly along the shaft with minimal trauma. It costs 280 pounds per syringe, offers instant visible results, and requires zero downtime.
It is the absolute peak of drive-through body modification. The historic line between serious therapeutic medical care and casual cosmetic enhancement isn't just blurring anymore, it is being erased completely. We are commodifying human biology at an unprecedented speed.
It really is a paradigm shift.
But this drive-through mentality isn't just limited to localized dermal fillers. We are now seeing this exact same cosmetic hijacking happen with serious systemic medications. Look at the GLP-1 drugs.
This is where the intersection of medicine and aesthetics becomes genuinely concerning for regulators.
Let's talk about Ozempic and Wegovy.
Right? Medications like Ozempic and Wegovy, which belong to a class of drugs called GLP-1 receptor agonists, were developed through rigorous clinical trials to treat highly serious systemic metabolic conditions.
They aren't meant to just shed 5 pounds before a wedding.
No, not at all. Their primary clinical purpose is managing type 2 diabetes and clinical obesity by mimicking a hormone that targets areas of the brain regulating appetite and food intake.
But because one of the most prominent physiological side effects of that mechanism is rapid, significant weight loss, These complex medications have been entirely hijacked by the cosmetic industry.
The hijacking has been so severe that the MHRA, the UK's official medical regulator, has been forced to issue strict, widespread public warnings.
What are people actually doing?
These systemic drugs are being routinely misused, rebranded, and sold illegally on social media platforms as cosmetic skinny jabs. Individuals who do not meet any of the clinical criteria for diabetes or obesity are purchasing counterfeit, unregulated, and potentially dangerous versions of these drugs online purely for aesthetic weight loss.
Which is terrifying, honestly.
It is. They are completely bypassing critical medical oversight. The government is desperately trying to remind the public that these are serious systemic medications that carry real risks of severe side effects, like acute pancreatitis and gallbladder disease. They are not harmless, cosmetic quick fixes to fit into a smaller dress size.
It paints a really striking picture of a modern society that demands instant, painless, injectable solutions for absolutely everything. From the physical shape of our noses, to our metabolic weight, to the exact intensity of our orgasms.
We want a quick fix for it all.
We really do. So, connecting all of this directly back to you, the listener, navigating this vast landscape of modern enhancements means you have to be incredibly discerning as a consumer of healthcare.
You really have to do your homework.
Exactly. If you are actively considering a procedure like the G-shot, you cannot approach it as a permanent medical cure. You have to weigh it as a serious recurring investment in your personal wellness budget. You are stepping into an overwhelming, highly aggressive market of rapid-fire cosmetic promises, and you have to decide if the ongoing financial cost is worth the temporary physical benefit it provides.
It requires a fundamental psychological shift in how we view healthcare spending. In this specific sector, you aren't paying a doctor to cure an ailment. You are paying a specialized technician to maintain a temporary enhancement.
Which brings us to the end of our deep dive. Let's do a quick, hard summary of the facts we promised to deliver on your mission today.
Okay, let's lay it out.
Number 1. The G-shot is unequivocally an out-of-pocket expense. It is completely ignored by all major medical insurance providers and is classified entirely as an elective cosmetic procedure.
Spot on.
Number 2. The cost is heavily dependent on geography and provider expertise. It will run you anywhere from a baseline of $875 in a medical tourism hub like Turkey, all the way up to $2,500 or significantly more in a premium U.S. market like Beverly Hills.
Yep, you pay for the zip code.
And number 3, the hidden catch. The hyaluronic acid breaks down. It comes with a mandatory renewal fee every 4 to 12 months if you want to maintain the physical effects of that filler.
Those are the stark, practical realities of the procedure, drawn directly from the clinical and pricing data spanning across multiple global markets.
But before we let you go, we want to leave you with one final lingering thought to mull over. Something that really stood out when analyzing the entirety of the medical landscape you provided.
This is a really fascinating discrepancy to think about.
It really is. As we touched on earlier, the data included extensive urology treatments for male sexual dysfunction. We're talking about highly invasive structural procedures like surgical penile implants, specifically the AMS 700 prosthesis, as well as UroLift procedures and medical vacuum pumps.
These are intense surgical treatments.
Very intense, and they are designed to restore or enhance male sexual function. But here's the kicker. Very often, these structural procedures are covered, at least in part, by health insurance. They are treated by the system as legitimate therapeutic medical interventions for a recognized medical condition.
The global medical establishment frequently validates male sexual dysfunction as a physiological disease requiring covered therapeutic intervention.
Yet, when a female patient experiences female sexual dysfunction, an issue that, again, affects over a third of women globally, and seeks out a localized procedure like the G-shot to enhance her physical pleasure and arousal, the insurance companies universally slam the door.
Immediate rejection.
It is instantly dismissed as purely elective, a luxury, a cosmetic spa treatment akin to a lip filler. So we leave you with this question to explore on your own. If the gatekeepers of health insurance refuse to cover a procedure like the G-shot because female sexual enhancement is deemed purely cosmetic, what does this glaring discrepancy say about how the modern medical establishment fundamentally values and validates male versus female sexual health and pleasure?
It highlights a profound structural bias hiding in plain sight within the very billing codes that govern our healthcare.
It's the muddy waters of medical diagnosis all over again. The diagnostic scale isn't just broken. It seems to be calibrated entirely differently depending on whose anatomy is standing in front of it. Thanks for taking this deep dive with us. We'll catch you on the next one.